You asked me what's the science behind wearing masks, as if it's controversial. Like, can you prove that to us? Can you present the evidence as to why we should encourage the public to wear masks? And I think the reason we even have to ask that question is because of the way we got started with our mixed messaging about should the public be wearing masks. And I think it's good to put a perspective on why that confusion originated.
This is a Tioga County COVID-19 Task Force Update. I'm Jim Nobles. Today, we're going to be talking about masking and the importance of following this simple task to keep our county safe and healthy. In our discussion today, we are joined by Commissioner Mark Hamilton, Dr. Ed Gielig, and Dr. Skip Clark. But before we open up the discussion, here are some striking facts. Since May 29th, when Tioga County moved to the green phase, we've seen a 90% increase in positive COVID-19 cases throughout the county. That's 15 additional positive cases in just 6 weeks. 7 of those positives have been in the last 2 weeks alone. So looking at that trend rate, that puts us on track for 14 positive cases in the month of July. This is a stark realization that the virus is still present in our community, and with summer events and people returning from vacation, now is the time for heightened vigilance and strict adherence to the CDC and Department of Health guidelines. Also, over the past 2 weeks, there's been some additional mandates at the state level, with Health Secretary Levine signing a mandatory masking order on July 1st, and yesterday, Governor Wolf announced new restrictions on restaurants, bars, and nightclubs. Today, the task force would like to spend some time talking about masking. Presently, as I'm sure you're aware, there's much controversy over masking and what this simple task does to protect our community. The commissioners fully support masking in Tioga County and recently did an excellent job with an update in the Wellsboro and Mansfield Gazette talking about the importance of masking. Mark, you and Commissioners Coolidge and Bunn, in your recent article, talked about the importance of masking, but from what I'm seeing in the stores, we still have some work to do. What can you say to our residents who still aren't masking in public?
Well, you know, Jim, we're seeing a lot of signs come up in our community that say, support your local business. And I think one of the best ways that we can support our local businesses is to wear a mask. You know, it just protects yourself, it protects others, the store owners, and it will keep the threat of shutting our businesses down again from happening if we can keep the virus out of here. You know, wearing a mask is not political. It's a proven piece of personal protective equipment. You know, over the years, I've worn a mask a lot when the time was right as an EMT. You know, people wear hard hats for protection. People also stop at stop signs to avoid the risk of injury. Athletes, they wear protective gear all over their bodies just to hopefully avoid any injury as they're playing. And you know what? Many of us wear sunglasses to protect our eyes. Now, why wouldn't we wear masks to protect ourselves and others from this COVID virus? You know, I have a suggestion. Let's make mask wearing fun by making a fashion statement. You know, why not think about supporting your favorite sports team? Or maybe just showing your patriotism with the red, white, and blue. Or maybe your favorite hobby. Now, this really doesn't work for me. I have a camo mask, but my son's probably wearing it right now. None of those work? How about just going black and white? And again, if you think those are not really going to work for you, how about a face shield? Now that's a fashion statement. You know, the bottom line is that we need to be positive and we need to work together. So whatever you choose to wear, again, keep in mind that we're all in this together. And let's get out of this together without our community having to shut our businesses back down or having a large case count. We deserve it.
Thank you, Mark. Very well stated. That makes perfect sense. Wearing a mask not only protects you from the health risk of COVID-19, but it also protects our businesses from any further restrictions. But now that we talked about the business aspect of masking, let's move to the science behind masking and the effectiveness of wearing a mask and how that can reduce the spread of the virus. Dr. Gielig, there's been much discussion in the medical communities around masking. In the early stage of the outbreak, masks were not recommended, and now the recommendations have changed. What can you tell us about the new data around masking?
Sure, that's a good question, Jim. Let's start by just putting this in perspective. We're 4 months, a little less than 4 months into this pandemic. This is a medical experience for us that we've never encountered in our lives before. We knew very little about the epidemiology of pandemics. In our lifetime, we've never really experienced this. So we went into this with a lot of unknowns. In just less than 4 months, we've learned a tremendous amount. We've made great progress. You asked me what's the science behind wearing masks, as if it's controversial. Like, can you prove that to us? Can you present the evidence as to why we should encourage the public to wear masks? And I think the reason we even have to ask that question is because of the way we got started with our mixed messaging about should the public be wearing masks. And I think it's good to put a perspective on why that confusion originated. To a great extent, we didn't know how this virus was transmitted. We also didn't have enough personal protective equipment to protect our healthcare professionals, and we were being overrun. It was quite terrifying, really, to us medical people, that we were going to be asked to care for people with a deadly virus, highly contagious, out of control, and we wouldn't have enough personal protective equipment, namely face masks, gloves, and gowns, to actually care for these people. You can only imagine what that must have looked like to us. I think our public health leaders, our surgeon generals, our task force leader, Dr. Fauci, the Centers for Disease Control, the World Health Organization said to the public, and I can remember Dr. Adams saying this, people, do not buy N95 masks online. We need them for our healthcare workers. And I think that was a reasonable thing to do, not knowing if that was in fact not necessary for the public to shield their face and to save these resources for our healthcare workers. Well, we all know kind of the fiasco that evolved with trying to procure this equipment. I think we're safe now. I think some state governors might disagree with me, but I think by and large we have what we need, and we've evolved to a different level of what kind of face coverings are effective. People can make their own face coverings with cloth. But that's kind of how that mixed messaging started, and it was really not based in any scientific knowledge. Since then, we've discovered two really basic scientific facts. They're indisputable. Number one, this is a respiratory virus, and it's primarily transmitted through respiration, through respiratory droplets that we now know scientifically transmit about 6 feet before gravity pulls them to the ground, hence the 6-foot distancing rule. And we also know that the viral particles can be aerosolized, which kind of creates a different problem for us. But you can inhale viral particles by being in a room where somebody was talking and it's just suspended in the air. Both form the basis or the rationale for wearing masks. And that's a scientific fact now. The other piece of information that we quickly deduced was that this virus is spread respiratory-wise from asymptomatic patients, pre-symptomatic. Before they really are sick and know that they have the virus, they're spreading the virus. That, again, is a premise or a rationale for when you go out in public, you don't necessarily know if you're spreading virus for 4 or 5 days after infection. So those two scientific facts just turn this thing upside down. Then the World Health Organization and the CDC for a while were contradicting each other, and we really didn't know in the medical profession what we should be telling our patients. And we didn't have these guidelines until more knowledge became apparent. But I can tell you the state of the art of medicine right now in this country, in the world, is overwhelmingly supportive of face coverings to prevent the respiratory transmission. You ask us for evidence, and Dr. Clark and I can tell you and quote studies. The prestigious medical journals are just overflowing with studies that are justifying the recommendation, wear face masks. I don't think we need to go into those studies for our audience here. But what I can tell you is that there's a huge amount of literature being poured out in the medical community. It's not even being debated at all anymore. It's a consensus, and it's really considered dogma now. We can stop the spread of this respiratory pandemic through face coverings of a variety of ways. They don't have to be medical grade in the general public. So those two facts are really where we start. Next, I want to just tell you that the World Health Organization, the CDC, the National Institutes of Health, the White House Coronavirus Task Force, and even our Surgeon General and his team are all in agreement that this is the recommendation that we should move forward on. There's nobody questioning it, nobody debating it. So we can present some science to you and maybe some scientific rationale, but we don't need to debate it anymore. This is really the way we have to proceed. So you say, is this just an opinion, wear masking? It's not. There's a plethora of epidemiological studies being poured out right now of the data that we've derived from first China, then the Italy experience, then our New York City experience. And we have tremendous amounts of data, and it's been compiled and analyzed, and there is a strong evidence that when mask guidelines and ultimately mandates were implemented, we saw a dramatic change in the transmission rates. And this is especially true in Italy when these measures, social distancing, closure of non-essential businesses, face mask mandates, et cetera, came in stages. We can study then what did the outbreak rates do in response to these. And it's really obvious in these studies that face masks made a big difference in the transmission. The last thing I want to bring up before I turn this over to Dr. Clark, my colleague here, is there's been a lot of modeling, and I'm not sure non-medical people understand what modeling is, but it's basically observing a database of an outbreak and then analyzing it and trying to interpret it with a set of assumptions and projecting if these trends continue, what will this look like September 1st, October 1st, November 1st? And you input assumptions of the worst case scenario. And you also program the model to look at the best case scenario. And that's how we've come up with these projections of 130,000 deaths by August 1st. We've seen that data and we say, who is this and why are they saying this and how do they come up with these ideas? But it's very mathematical and it's very scientific. Well, what we've been relying on, if you read the fine print, is the University of Washington Institute of Health Metrics. They're the number one authority in doing this modeling for us. And this is the thought I want to leave you with for right now. They just released this week a new prediction on the outbreaks in our South and Southwest that if this trend were to continue, they modeled 224,000 deaths from COVID-19 by November 1st, if these trends progress or continue. But they said they programmed the model to look at if 95% of Americans wore face coverings and they plugged in the data that we know how it reduces the outbreak, we could prevent 33,000 deaths by November 1st. Now, when you think about that, what is the cost of everybody donning face protection? There's very little downside to that. It's not a tremendous inconvenience. It's not expensive. It's doable if we had the will to do that. And if you believe in science and you can question our conclusions, that's fair game. But if you give us the reasonable benefit of the doubt, there's the possibility that we could eliminate or reduce the death rate by 33,000 people just in the next few months by November 1st, according to this model. And that's a very powerful, sobering thought. With that, I'd like Dr. Clark to give us some of his thoughts.
Thank you, Dr. Gilly, and Jim as well, and the other panelists here. So, as folks know, I'm a pediatrician here in the community, and one of the aspects of this that I need to comment on is what is the situation for pediatrics and pediatric patients, the children in our community. We have a recommendation that any child over the age of 2 wear a mask. Under the age of 2, it is a choking hazard and for them, and so that's why they're not recommended. Common issue that we see with the younger child is that the 2-year-old, it's hard to keep a mask on. It's hard to keep a mask on a 5-year-old sometimes. But what we found, I think, in the studies that have looked at this as well, is the best thing we can do to help that younger child to wear the mask is for the parents to wear their masks. And so it comes back to what Dr. Gilly was saying, is that everyone needs to wear a mask. So it needs to be a consistent habit for all of us to begin and to continue. Other things that we've looked at and know as well. This will cut our infectivities, depending on the study that you look at, from in half or up to 5 times the risk associated with the contracting the illness. Other things that can help, obviously the things that we've talked of before, not congregating in crowds, weddings, birthday parties, these types of things. The governor took advantage of this recently when he changed the situations for restaurants. Social distancing, that's that 6-foot rule. One thing I wanted to point out here is that what we have is that if you have are indicated as a positive contact, that means that you've been less than 6 feet from a person who has the virus for less than 15 minutes. So it's not a long time. And so, that makes you likely to get the illness. We need to social distance, and we need to also protect the vulnerable of our population. That's regardless of age. And so we see that in our pediatric population, children with chronic illnesses, but also people greater than 65 years of age, folks who are have pre-existing conditions such as kidney disease, heart disease, asthma, type 2 diabetes, and our patients who are overweight. We use a measure called a BMI, and the BMI over 30 is an indication that patients may be at risk for this acquiring this infection. A BMI, to give you some perspective on that, someone who's 5 foot 4 inches and weighs 175 pounds has a BMI of 30. Someone who's 6 feet tall and weighs 220 pounds has a BMI of 30. So anyone over those measurements could be at risk for acquiring this infection. So it includes a lot of people. So the best thing we can do here is to decrease that risk. And the number one thing that's on the list, bar none of the other things that we've talked about, is to wear a face covering.
Yeah, thank you very much, doctors. Great information. You used some very powerful words in there. Indisputable, irrefutable, when you talked about the evidence. So we do have some questions here that came in from our viewers. So one of the questions that came in, do healthy people need to wear a mask?
Start there, yes. Healthy people definitely need to wear a mask because healthy people are the asymptomatic. Because asymptomatic people are the carriers of this illness. As Dr. Gilley pointed out, you may be not showing any symptoms at all for several days after you started to acquire the infection. And during that period of time, you could be passing it along. And that's the reason for universal masking, is because that's how we capture and keep those asymptomatic people who have no symptoms, from spreading that.
That's exactly right.
So then, a follow on to that question, as a non-symptomatic person, me wearing a mask, does it provide me as a person a degree of protection from contracting the virus, or am I protected by wearing the mask, not spreading it to another person? I think there's a lot of confusion around that. We've heard the health secretary say, my mask protects you and your mask protects me. But if I'm wearing a mask, don't I also get a degree of protection because my face is covered towards breathing in those droplets that you mentioned?
I think we don't know that answer with absolute certainty. It's being studied, it's being looked at with these viral particle-laden respiratory droplets. We know that the primary purpose of this public health measure is to slow the transmission. So you're not really protecting yourself, you're preventing the spread if you are an asymptomatic spreader of the virus, primarily. However, they're looking at studies now and they're saying even cloth, homemade, home-fashioned face coverings do in fact stop respiratory droplets. Now, virus particles are 0.3 micron. That's what the N95 respirator is for. When we are dealing with intubation of a COVID-positive patient in respiratory failure, you are being exposed to the virus 6 inches away from your face. That has to have a proven shield that will stop the virus from transmitting into your lungs. That's not our public measure objective when we're asking people to wear a face covering in public. We're asking that primarily so that if you are unknowingly spreading the virus, it will be contained. Jim, let me just share real quickly what's called a case study that's been in the literature and popularized recently. It's been in the lay press too, so many people have heard of it. There was 2 hairdressers in Missouri recently, and this has been written in the medical journals, who went to work wearing a face mask, running a fever, and having a cough. They were later diagnosed as being positive for COVID. The 2 of them saw 139 patients in close, intimate contact doing their hair or whatever, and they required in their business that all of their clients wear a face mask during the procedure. They COVID tested all 139 and they were all negative. So it just speaks to the efficacy of not transmitting that virus to those 139 people over the course of 4 days after finding out they were in fact positive. And compare that to some of the beach parties you've heard where 10, 15 people left the party and tested positive 4 days later. And we know this is a highly contagious virus. It has receptors for the human lung, like few other viruses. So the efficacy of the face shield or the face mask is really impressive, but it's primarily to stop the spread.
So let's touch on that. Let's touch on that briefly. We've talked about, we've thrown some terms out there. N95. Commissioner Hamilton did a great job of demonstrating or actually modeling some of the different masks out there. So Dr. Clark, in your opinion, is one mask more effective than the other? I know an N95 is the kind of Cadillac of mask, and it filters out, as Dr. Gielig pointed out, the 0.3 microns. But what should somebody be putting on their face? Should they be looking for an N95 mask, or what kind of face covering do we want to recommend to the viewers?
Well, I think first off, Jim, to touch briefly on the N95 mask. The N95 mask is intended for healthcare professionals, okay? They are, to be effective, they need to be fitted, they need to be tested to make sure that you have the right size to fit your face so that it works to basically block all air transmission in and out of your body. So you only breathe through the mask. And because of that, these things are incredibly uncomfortable, okay? And therefore, this is not something that the general population should be wearing because they're not comfortable. They won't wear them, or they won't wear them properly. And an improperly fitted mask gives you a false sense of security. So you have to be conscious of that. So what we need, as the commissioner pointed out, we need people to be, to have fun with their masks. They need to be comfortable with their masks. So, make a fashion statement, do the camo thing, that kind of stuff. The studies have shown, in studies that have looked at universal masking, not stratifying, not looking at the type of mask, not any other those types of things, just straight out universal masking, you can drop your infectivity rate in half. So basically what we want to look for is we want to have people comfortable with their masks and use them properly. Now, to quote Governor Cuomo up in New York State, we need to wear a mask, which means it covers your mouth and your nose. We don't need to wear a chin guard. We need to wear a mask. So it needs to be properly, fitted and worn. And you need to be comfortable with it. So try different types. I know Dr. Gielig and myself have talked about it. I've tried probably a half a dozen different types of masks before I found one that I was comfortable with wearing all day. And, we wear a mask probably 12 to 14 hours a day. And so you have to find the right fit. But the point is to wear one, okay? Not necessarily what it is.
So indisputable evidence from two pillars of the medical community right here in Tioga County: wear a mask. Commissioner Hamilton, no matter how scientifically we present the data, no matter what physicians we have on this program, we've got to appeal to one sense of community. There's always going to be people out there that simply won't comply. What are we going to say to those people to try and change their minds?
Well, Jim, these are unprecedented times, and people out there are very upset. So I think the key word is respect for others. There's a lot of us out there that want to keep doing social activities or our jobs, and that respect for other people's rights is a key factor. There's a lot of civil unrest, and we need to keep civil in our community.
So we want to close out this segment. We know masking is important. It protects you, it protects the community. Dr. Clark, what's the key takeaway you want everybody to remember from tonight's broadcast?
That your mask protects others around you, and their mask protects you. And by wearing a face covering such as a mask, you're protecting the people closest to you.
Dr. Gielig, same question. As we close out this segment, what's the one key takeaway you can send to all our residents in Tioga County about masking?
I guess I would just reiterate that any type of facial covering benefits our community. Any type. And secondly, just remember that there's really very little downside to putting this effort into protecting others. And there's tremendous potential upside in doing so. That's what I want to say.
Perfect. So here's the bottom line from the task force. When you make the choice to wear a mask, it sends a clear message to the community that you care about everyone's health, you care about the well-being of the community as much as your own. Conversely, when you refuse to wear a mask, you're also sending a message that you don't care about your community, you don't believe the science, you don't believe the medical experts that we had on the show, and you're making this a politically charged issue instead of really doing what's right to protect your family, your friends, and your neighbors. Community means everyone, and the simple act of wearing a mask is how we protect everyone's health and the fastest course to restoring our economy and returning to some degree of normalcy. So please, mask up when you're in public, continue to follow social distancing, and wash your hands.
For all your ends, C and N.